For the skill that I am demonstrating, I have lumbar traction. For the patient position, I am doing supine with the legs extended. I will loop a belt around the patient's ankle in a figure eight, and then place my hands above the ankles, and then I'll lean back into the belt. If the patient feels like they are moving on the table, they can try to hold themselves in place with their upper body with their hands bracing themselves on the table. I will slowly increase force on the lumbar spine. I'll try to avoid going too fast with the force. And since this is the first time, I'm not going to try to put too much traction on the lumbar spine. For the parameters, I'm going till the patient starts to feel symptom relief. I'm going to be doing a static hold once I get to that point and for 10 minutes. Some of the things to observe for during treatment is peripheralization of symptoms. If this is occurring, then I'll stop immediately. Other things that would make me stop immediately are increased pain, onset of numbness and tingling in the legs. If the patient is having reduction of symptoms, then I will continue the treatment. Some of the stuff for documentation is the type of traction, the area treated, patient position, parameters for traction, duration of treatment, and patient response. Some important notes for the treatment. For after the treatment is to make sure to remove the strap from the patient ankle and to let them know that they can take some time to get up and don't rush too much because it may cause a faint feeling or dizziness. After the treatment, they need to avoid sitting down or compressive forces on the lumbar spine, and exercise and trying to educate on how to maximize the traction session is important too. And then now I'm going to demonstrate. So today we are going to be doing lumbar traction. It's going to help with your lumbar low back pain. I'm going to be having you lay down on this table, and I'm going to put this belt around your ankles as I already done. I'm going to hold above your ankles and lean back into the belt, providing traction on your lumbar spine, which will decrease your pain and symptoms, as I'm demonstrating now. This method works by separating your lumbar vertebrae and your lower back and can decrease the pain and symptoms, thereby distracting the joint and removing some of the pressure on the structures that are causing pain in the area. It requires a moderate force from me in order to see the changes in your symptoms.